I am Dr. Poonam Patil, medical oncologist from Manipal Hospital, Bangalore. I am going to discuss today about breast cancer, therapy of breast cancer, chemotherapy, side effects, and how to get over them.
To start with, Doctor, what is breast cancer?
Cancer as such is uncontrolled growth of cells which may occur anywhere in the body. Normally our cells grow in a controlled fashion. Now if the cell control is lost, these cells keep growing and these extra cells form a tumor. When such a thing develops in breast, it is known as breast cancer.
And how far the cancer spread and what does it mean?
Cancer can spread from the breast to other parts of the body through lymph nodes and through the blood. It can spread anywhere from head to toe, but the most common sites are the nodes, that is the first site most of the times. And apart from that, it can spread to the bones, it can spread to the lungs, liver, brain, and many other areas such as the skin and soft tissues.
So what are the treatment options available, Doctor?
Treatment for breast cancer involves surgery if it is a localized disease, radiation therapy if it is a localized disease, chemotherapy or systemic therapy forms most of the times an essential component of treatment of breast cancer. Systemic therapy means either chemotherapy or hormonal therapy or both. This depends on the stage of the tumor and the type of tumor, that what kind of systemic therapy are we looking at.
So Doctor, when will the treatment start and how long will the treatment last?
The treatment generally starts once we confirm the diagnosis of breast cancer. If it is a localized operable disease, we can go ahead with surgery, and then after surgery we get the exact stage of the disease, and depending on the stage plan for the treatment. If the disease is inoperable, that is it is locally advanced, then sometimes we give chemotherapy first, which is known as neoadjuvant chemotherapy. With that we shrink the tumor so that surgery is a good surgery and they are able to remove the disease entirely, and then after that surgery either radiation is planned or chemotherapy is planned depending again on the stage and type of tumor.
So Doctor, what will happen if patient does not take the treatment?
If patient doesn't take the treatment, then obviously the cancer cells that are still remaining within the body in spite of surgery, they may be floating somewhere in the body, in the blood or in the lymph nodes. They start growing and again they invade other parts of the body again. And if it invades the vital organs such as the lung, liver, brain, obviously it could be life-threatening at that point of time.
What are the possible side effects of the treatment, Doctor?
I can talk to you about side effects of chemotherapy. Now chemotherapy is drugs given to kill the cancer cells. Now we don't have a chemotherapy that is very specific only to cancer cells. So the chemotherapy, apart from killing the cancer cells, also kills body's normal cells. Now when it kills the cancer cells, we are very happy saying that the chemotherapy is working well, but when it affects the body's normal cells, we are not happy about that and we call them as side effects of therapy. The chemotherapy side effects again can be on all the organs, and most of the times it is the blood cells, the white blood cells which are affected, which are very worrisome to us, and that is known as neutropenia. When the white blood cells come down, that time the person is prone for infection, and these infections can become life-threatening in extreme situations. So febrile neutropenia, that is whenever there is neutropenia associated with fever, it is a kind of medical emergency. That is the most worrisome emergency that happens during chemotherapy. Apart from that, from the patient's perspective also, nausea, vomiting, weakness, hair fall, sometimes diarrhea, sometimes cough. These are the common side effects, weakness, fatigue. They are there, but most of the times they are all able to overcome all these side effects.
When the patient is on treatment, will the patient require any other test treatment?
When the patient is on treatment also, we have to keep looking at the patient to see that there is no new tumor developing, there is no disease progression, how is their tolerance to chemotherapy, how is the disease status, especially if it is an advanced disease, whether the chemotherapy is working or not. For that, some clinical examination, imaging may be required from time to time.
Doctor, once the treatment is over, how often will the patient need a checkup?
The patient is generally called for a checkup once in 3 months, And once in 3 months, we are not going to do all the tests or anything. Most of the times it's clinical examination and an interview of the symptoms that the patient had in the last 3 months. If in that interview or during that dialogue we feel that this particular system is little worrisome or this particular symptom is worrisome, then we ask for some investigations. And those investigations could be blood tests or could be imaging. And they are basically to see whether the cancer has spread to any other organ or not. Supposing the patient says that I am having back pain, then I'll ask her to do a scan of the bones or even a CT scan or an MRI of the spine. So it is all symptom directed investigation that we would ask for. Otherwise, once in a year we do mammography of the breasts to make sure that there is no new tumor developing either in the same breast or in the opposite breast. That is the main thing that we do every year.
Doctor, while on treatment, what do the patients need to be careful about?
As I said that neutropenia and fever, which is termed as an oncologic emergency, that is something that we are very worried of. So the patient needs to avoid infections at all cost while on chemotherapy. Now how they can do that? Infections most of the times comes through food and water. So if we take care of food and water, we have avoided most of the infections. Eating homemade food, drinking boiled and cooled water makes most of the difference. There is no specific thing that should be avoided unless the patient is intolerant to a particular food substance, then obviously they have to avoid that. But everything should be homemade and cooked. Then there is no other restriction.
Doctor, when should the patient call you in emergency?
If there is fever, they should call us. Basically, we say that if there is anything out of turn that they feel, they should immediately let us know, and we will tell them whether they should worry about that symptom or not. But they should let us know if there is fever, or if they are not able to tolerate anything orally, or if there is diarrhea, or if there is cough, or if there is severe fatigue, or if there is confusion, which may be due to electrolyte imbalances sometimes. So these are the things that they should let us know immediately. If there is any treatment to be taken for that, we'll let them know accordingly.
Thank you, Doctor.
Thank you very much.